Hello, my name is Kay Woodgate. I'm a movement therapist, and today I'm going to talk briefly about what to do in cases of sciatica. Now, sciatica is very much a catch-all word. It's a bunch of symptoms that we tend to refer to as sciatica. There is the true sciatica and the pretend sciatica. More of the true sciatica is referral of nerve awareness down the left or right calf, so below the knee. If we are feeling symptoms somewhere else or we're feeling symptoms higher up, it is not the true sciatica in the sense of the word. If you have the true sciatica, there is a need to do some nerve entrapment work, which is manual one-to-one type work. It's really helpful. However, not everybody has got access to those resources at the moment when the discomfort strikes. So what do I recommend doing in cases of generalized back discomfort coming from an entrapped nerve or a spinal disc or muscles that are pressing on the nerve along its course? There's a couple of things that I recommend, and I'm going to talk you through those. So one of the first things I recommend is working to strengthen your back and do certain breathing exercises. And we need to make sure that the exercises I give you are appropriate for your degree of readiness for them, because they come in stages. So when we're really severe, flared up and really uncomfortable, obviously I'm not going to suggest you do the more complicated versions. Therefore, I'm going to start really simple. For this, you need something like a sofa, a bed or a chair. I'm going to use my chair here, and likewise you can use the edge of your sofa or a hard bed. If you can get down to floor level kneeling, that's going to be very beneficial in this case. If you can't, we need to think about another approach for you. But if you can get down to floor level and kneel in front of this surface, like a bed or a chair, and what you're literally going to do is take one hand on top of the other one, like make a pillow with your hands. Place your folded hands and your forearms on this surface. So I'm placing them on a chair with my elbows being supported. They might feel like they're floating and the chair's not wide enough, but a wide enough chair, or obviously a sofa or a bed, is going to have your elbows supported. And then you're placing your forehead on your folded hands, like on a cushion. Now, notice what happens to the rest of my body. Can you see that my hips are over my knees and I'm folded at the hips here? So it's kind of a 90 degree fold, hips and knees. And I'm tucking my toes under if possible. And in this position, I'm gently going to press into the forearms as if I'm lifting the collarbones away from the floor and gathering my collarbones into my body. And then I'm going to keep my neck nice and long so the neck does not collapse like this and my nose isn't going to push into the sofa, chair, whatever. And the shoulders are gently drawn away from the ears. And I'm keeping the sense of pushing into the forearms whilst keeping my forehead down on my folded hands. And in this position, keeping the neck long, shoulders away from the ears, and hips folded at 90 degrees, I'm going to breathe low down into my lower rib cage, into my back and into my belly. And when I exhale, I do this with a nice long exhale, like I'm blowing candles out. Imagine there's a cake underneath you. You're going to blow at those lovely candles nice and long, nice and long, nice and long, all the way to the end. And I'm going to do several cycles of this breathing whilst I'm keeping my neck long. So in this situation, make sure that your breath does not elevate your shoulders. So you're going to practice lengthening the neck and breathing low down into your rib cage and a little bit into your abdominals. So that's exercise number 1. And make sure that when you do this, you're not dropping the tailbone down underneath between your legs, like I'm showing you now, but you're keeping that sense of a gently lifted tailbone, but at the same time, you're not dropping your lower back into a big arch. So it's as if you're gathering your ribs into your body whilst you're drawing your collarbones into your body. And that is one of the more accessible exercises. Obviously, if you can't kneel down or your knees need padding, please pad as much as possible. If you need another modification, let me know. Some people even start with being seated, and I don't have a table in front of me, but they start being seated, place their hands on some lift on top of the desk, and they start breathing in this position. That would be an even more accessible way of getting into that breathing. And again, we're keeping the neck long and the breath down low. So that's definitely position number 1. Another exercise I want to share with you for acute back spasms is if you can get down to floor level and then come back up. So make sure you can come down and come back up safely, especially if you live on your own. It's actually, again, using something like a chair or a bed, but in this situation, you're coming down to floor level, and this time you're going to have your knees up over your chair seat, and then you're going to lie on the floor. Now, most of us will benefit from having a cushion underneath your head, because for a lot of people, when we lie on the floor flat, the chin pops upwards towards the ceiling. We don't want that to happen because that creates tension in the neck. So make sure you've got the cushion underneath your head so that when you lie down, your neck is comfortable and the chin feels like it comes closer to your collarbones. And then in this position, whilst you are getting your head lifted, actively press your heels into the chair, keep your knees bent at 90 degrees and your hips bent at 90 degrees like I'm showing you now. Stretch into the heels and then allow the back of your rib cage to drop heavy into the floor. And here, as soon as you're comfortable on the floor, allow your thigh bones to just release deep into the sockets. So you're feeling that you can let go of any tension around your hips and around the kind of all the areas around the pelvic floor, etc. And in this position, just start with some quiet breathing, allowing your body to relax, and just allow that sense of calmness and depth in the tummy. And then when you feel that maybe that helps with your back situation a little bit more, we can do some little bit more of an active breath. So you're going to breathe in, keep that breath low into your lower ribs and tummy. And as you exhale, imagine blowing at a pretend cake again, which is right above you. All the way out. And as you're practicing this inhale and the very long, prolonged, quiet, lengthy exhale, keep your shoulders calm, keep your neck relaxed, keep your jaw soft, face relaxed, and keep allowing those thigh bones to drop into the sockets. So this should be quite calming breathing, and it also can help with deeper discomfort. If somebody's been in a back spasm for a little bit of time, that can really allow after a while for those muscles to release, for the body to rebalance and come back into greater equilibrium. And then people build on that, but first and foremost, we need to get people out of that back discomfort. If you wanted to do a little bit more, then perhaps doing some little pelvic movements, literally exhaling, blowing at your pretend cake and gently coming into a little bit of a pelvic tilt, as if you're putting your pubic bone closer to your nose, and then inhale, rock your pelvis in a way as if your pubic bone looks towards the floor. So it's literally you are exhaling and your pelvis tilts towards you as if you're spilling water from your belly into your waist. Inhale, rock the pelvis as if you're spilling water out of your belly towards the floor in the direction of the chair or sofa in front of you. And just very gently rock, but keep that exhale going nice and long. And keep the shoulders and neck nice and quiet. And that's just a little progression, just to explore whether any of those movements are in any way catching. All this time, make sure that you're not in discomfort. If you find the edge of discomfort somewhere, just shy away from there, come back into a more quiet pelvis, and really allow yourself to release. Clearly, if any of these positions is uncomfortable and gets worse, I recommend you come out of there straight away, speak to me or seek professional advice. I'm very happy to see people online and in person. I've got lots of experience of treating back pain, and there's lots of things we can do individually. If this hasn't worked, or if you want to progress further and really find the real true cause for your back discomfort. I hope you enjoyed this video. So my name is Kay Woodgate from Move Beyond. I hope you enjoyed it. Give us a like and chat to me if you would like any further advice. Have a lovely rest of your day, and bye for now.